We're going to give it just a minute. So anybody that's on here, just please be patient with us today. Good afternoon and welcome to Partners Member Café. My name is Melissa Hatton and I'm a part of the member engagement team here at Partners. Thank you for joining us today for our monthly Partners Member Café. Joining us on our panel today are some of our member engagement teams. So if you'll just give a wave when I say your name: Lindsay Green, Kimberly Lambert, and Susan Griffith. We are offering today's session includes captioning. If you don't need this feature at the bottom of your screen, you can simply hover over Live Transcript and click Hide Subtitle. For those of you who are new to Partners Health Management, we are a managed care organization for North Carolina Medicaid and other state-funded behavioral health services, mental health, substance use disorder, intellectual and developmental disabilities, and traumatic brain injury. At the end of our session today, I will share a little more information with you about Partners and the member engagement team. Before I introduce our guest speaker, let's go over a few housekeeping items. This meeting is being recorded. Please do not share any sensitive personal information during this webinar. Partner staff is available after the member cafe ends for individual issues you may want to discuss, and we can also schedule a time to talk one-on-one. The recording and PowerPoint slides will be available on our website at www.partnersbhm.org under the Member Education tab. Please feel free to put questions into the Q&A features as we go through the information, and we will moderate and answer all the questions at the end, or someone from Member Engagement would be happy to speak with you afterwards. You can also raise your hand and we can open up your mic and you may speak your questions or voice any comments or concerns. Next slide, please. Our guest speaker today is Janora Jones. Janora K. Jones is an outpatient therapist with the Center for Emotional Health, where she provides individual therapy for teen and adult clients with diagnoses such as anxiety, depression, and bipolar disorder, among others. Her approach to counseling is based on the core belief that every individual is capable of self-direction and growth. Janora is licensed as a clinical mental health counselor in North Carolina, a licensed professional counselor in Texas, and as a national certified counselor. Besides her role as a therapist, Janora is also a trainer and speaker on mental health related topics. Minority Mental Health Awareness Month is observed annually to raise awareness. Can you go back one more slide? Sorry. To the unique mental health struggles of communities of color. This presentation will provide a general backdrop against which to understand these mental health issues, as well as offer some ideas for starting change in oneself, one's family, and one's community. Thank you for being with us today, and please welcome our guest speaker, Janora Jones.
Good afternoon, everyone. It's my pleasure to be with you, and I just want to thank you all at Partners for inviting me to speak and to talk about a topic that I'm very passionate about, which is mental health, and especially during July, which is Minority Mental Health Awareness Month. So as Melissa mentioned, this is intended to be just kind of a general overview about mental health and why it's specifically important to talk about minority mental health. And so if you'll go to the next slide, I just want to kind of introduce, why is there a Minority Mental Health Awareness Month? Well, it was first recognized in 2008, and the kind of real sponsor of it was B.B. Moore Campbell, and she was a very well-known best-selling author, especially in the 90s, who did a lot of work on mental health as a writer. She was an advocate. She also had lived experience as a parent of a daughter who lived with bipolar disorder. And so the goal of Minority Mental Health Awareness Month is really to enhance public awareness and to really talk about access, because one of the key issues that kind of exist around minority mental health is kind of access to treatment and just the general awareness of the issues that exist in minority populations. And I just kind of want to highlight that, as kind of terms change, as culture changes, Minority Mental Health Awareness Month is becoming more known as BIPOC Mental Health Awareness. And for those that are not aware of that term BIPOC, it stands for Black, Indigenous, and People of Color. And the term is kind of becoming more used to raise awareness to the idea that within kind of minority communities, there are particular communities that may face more stigma than others. If you'll go to the next slide. So the importance of focusing on BIPOC mental health issues, and I'll use minority and BIPOC kind of interchangeably throughout this, um, is that they're just systemic inequities. And many of these inequities are interrelated. And so there's less access to treatment, and that's for a number of reasons. Some of it may be location of treatment, transportation to treatment. Um, Minority folks are just less likely to receive treatment. Some of that's just because of the historical structure of medical systems, tendency towards treating other communities, poor quality of care, and we'll talk a little bit about this later. Higher levels of stigma both within and outside of communities of color. So certainly within communities of color, there is a lot of stigma about mental health, kind of praying it away or keeping things within families as opposed to seeking outside treatment. I would say outside of communities, just the stigma of what mental health looks like in communities of color, and that it may look different, and in fact, it doesn't really. A culturally insensitive healthcare system, and just our healthcare system has ideally been organized for kind of cisgendered Caucasian men, and so really doesn't do a good job of taking care of the healthcare needs of women or people of color. Racism, homophobia, discrimination within the treatment settings, language barriers. So for those folks for whom English is a second language, we don't necessarily always do the best job of treating them equally or getting a chance to understand what their needs are. And then last but certainly not least, health insurance. And so looking at what health insurance rates are like and people's actual access to care because of cost. Next slide. And so what I want to do over these next slides is, minority communities are not a monolith, certainly. And I just think in terms of trying to get just some sense of what minority mental health looks like, it may be helpful to get an understanding of what mental health looks like in specific communities. So I'm just going to talk about a few statistics within minority communities specifically, just to give you an idea of, what does mental health look like? So I'll start with the Black and African American community. And, one of the things to note is that certainly that community is becoming more diverse. And I say Black and African American because the Black and African American community is becoming much more of an immigrant community relative to what it has been. So in 1980, there were less than 1 million immigrants in the US as opposed to over 4 million today. And so again, much more of the diaspora is represented. When we think about what African American or Black households look like, about 30% of those households are headed by women as opposed to 9% of majority households. And so when we think about things like that, that may make those households look a little bit different, what does mental health look like? And so this first stat, about 16% of Black and African American people reporting a mental illness and 22% reporting a serious mental illness, that's not really so different from the general population of 1 in 5 Americans dealing with mental illnesses. And I think that statistic is just overall important, that 20% of people are living with a mental illness. And so that really isn't different in most communities. What may be different is some contributing factors as to why those mental health challenges may exist. And so, thinking about Blacks and African Americans, historical adversities linked to slavery, which have kind of resulted in some socioeconomic disparities, um, have resulted in some of these mental health challenges. And I'll talk a little bit again about what that may look like. And so I think when we look at, mental health, it may sound the same, but there may be some underlying causes that look a little bit different. And these are not self-reporting stats. These are actually statistics, many of these through NAMI, the National Alliance on Mental Illness, as well as Mental Health America. And so one of the things that, thinking about mental health challenges that I think is important to remember and is also important to recall as we talk about minority mental health is the connection between mental health and physical health. And so what we see a lot of, especially in the Black and African American community, is we see higher rates of diabetes, AIDS, HIV, heart disease, stroke, asthma, all sorts of physical ailments that very much are linked, I think, to mental health challenges. And as we look at what trauma and stress do to the body and what it also does to the mind, we see these things kind of go hand in hand. And so that historical adversity shows itself both mentally as well as physically. One of the things that's also important to recognize, and I mentioned this in stigmas, is that our healthcare system has stigma. And so what we see is that Blacks and African Americans are more often diagnosed with schizophrenia and less diagnosed with mood disorders compared to white people with the same symptoms. And so this is where, the folks providing care, so physicians, mental health clinicians, have to look at what their own biases are, because you may see two people who are presenting with the same symptoms, but because of our own biases around race and culture, I may see one person as presenting as maybe more clinically significant around like schizophrenia, which may seem like a more, let's say, a more significant diagnosis, a more severe diagnosis than a mood disorder. Even though, let's see, question in the chat. And let's see, what is the question? Are these self-reporting stats? No, these are not self-reporting stats. And so again, these are stats that are coming through some organizations like NAMI, which is National Alliance for Mental Illness, and Mental Health America, as well as the National Institutes of Health. And so again, the idea that our health systems have their own challenges, Blacks and African Americans are offered medication and therapy at lower rates. And so again, even though, the prevalence of mental illness may be similar, treatment is not the same. And so one of the things that studies have shown consistently is that physicians have a different perspective on pain tolerance between Blacks and whites, and have a perception that Blacks can tolerate more pain than whites do, and therefore prescribe less pain medication. So if you want to kind of take that physical idea of pain to mental pain, there's a similar difference in terms of treatment, and I think contributes to why medication is offered at a lower rate. Similarly, treatment in terms of clinical visits, Blacks have a more difficult time getting treatment. Similarly, they have a more difficult time with substance use treatment. And this last stat was probably the most disturbing for me, which was that nearly 90% of Blacks and African Americans who needed substance use treatment did not receive it. With that said, I also want to point out that of whites needing substance use treatment, only about a fourth receive it. So it's not that anyone's overwhelmingly receiving substance use treatment, and yet for African Americans, we're only talking about 10%. So next slide. And so again, this is only a little bit of a snippet. So I want to talk a little bit about American Indian and Alaskan Native communities. Is that in these populations, mental health issues are higher disproportionately than the general population. And so Native and Indigenous folks report serious psychological distress 2.5 times more than the population. Similar to African Americans, and though a very different history, historical factors very much impact the prevalence of these mental health issues. So when one thinks about the history of American Indians and Alaskan Natives and being taken off of Native lands forcefully, being put onto reservations, um, Indigenous children being taken off of the reservation, forced into boarding schools, all of these sorts of historical traumas that impact mental health issues. One of the interesting things is that, we talk a lot socially about alcohol use disorders and Native Americans, and yet the reality is that overall substance use is about the same as the overall population. And yet, in terms of treatment, access to treatment, is not the same, which may make it a more visible issue when one thinks about Native American or Indigenous cultures. Traditional healing systems, or one thing I think is important to think about when we talk about Indigenous Americans is that when we think about treatment and care for any community, we have to be sensitive to what are the values of a community. And this is where I think we have opportunities within our healthcare systems is, do we look at what's important to a community in terms of how we treat them, or do we try and treat everyone the same? Not recognizing that for someone who may be an Indigenous American, that traditional systems that focus on mind, body, and spirit may play an important role in terms of one's willingness to seek treatment and one's likelihood to stay in treatment. Next slide. And so I want to spend a little bit of time talking about Asian Americans and Pacific Islanders. I think it's important to recognize, particularly the diversity of this group, that there are about 50 subpopulations that are considered Asian American and Pacific Islander. And so this includes folks from, China, India, Southeast Asia, Hawaii, Guam. And so you're talking about a very diverse community with very diverse experiences, and that Asian Americans and Pacific Islanders are the fastest growing ethnic group in the US, having grown 72% between 2000 and 2015. Within this group, I think this is a group that particularly is painted with a very broad brush societally, and that diversity within the group is not really seen or taken into account the importance of what that means, like, let's say, from a mental health perspective. So thinking about certain things like, let's see, Southeast Asians versus, let's say, Chinese, is Southeast Asians are more likely to receive a diagnosis of PTSD associated with immigration patterns because of the history of immigration patterns of Southeast Asians, as opposed to how many Chinese Americans arrived in the US. For example, Southeast Asians socioeconomically may not have the same socioeconomic status as Asians from other places. And so when we think about things like barriers like the model minority, so a stereotype that, Asians are good in math and science, those sorts of stereotypes that people hold, that, we don't think about what might be a mental health outcome of that, but think about a teenager that's in school and everyone assumes that they're supposed to be the smart Asian kid, and they may not be great academically, but everyone assumes that they're that smart Asian kid, the mental health pressures that are associated with that. So then we think about, why would suicide perhaps be the leading cause for Asian Americans 15 to 24, although their overall suicide rate is half of that of non-Hispanic whites? Is suicide, there are a lot of reasons for suicide, and, societal pressures around performance, societal pressures around, just kind of what it means to maybe be a first or second generation immigrant in the US, All of these things are factors that may impact someone from a minority community that doesn't impact someone from the majority community. Of all communities of color, Asian Americans are the least likely to seek mental health services, being 3 times less likely than white counterparts. And, the question earlier about self-reporting statistics, for self-reporting statistics, Asian Americans are also the least likely to self-report mental health conditions. Next slide. And so the last group that I want to spend some time talking about are Hispanic and Latinx community. And so the Hispanic community is at lower risk of most mental health disorders compared to non-Hispanic whites. I think what's interesting is that older Hispanics and younger Hispanics are particularly vulnerable to psychological issues. Older Hispanic adults because of immigration issues, and then younger Hispanics because of acculturation issues, possibly because of being, let's say, that second or third generation person in the family, being acculturated in the US, having to straddle the fence between traditional family values and, kind of maybe, let's say, more American values. What I think is important to think about from a treatment perspective is that for, again, Hispanic folks who are English not being their, let's say, first language, not getting the same level of care. Many studies have found that if a bilingual patient is evaluated in English as opposed to Spanish, that they do not receive the same level of care, that their level of care is higher when they're evaluated in English. And so, these are things that as a community, it's important to consider. Another thing that's interesting is that within the Hispanic community, and I think this is also true for other communities of color, because mental health issues are not something that are commonly spoken of, people tend to present with physical symptoms. So for example, with depression, symptoms of depression are things like fatigue, change in appetite, loss of interest in activities. And while one may be able to talk about these things in terms of the way they may mentally impact, one may also focus on these things from a physical perspective. So if I come into a doctor's appointment and I talk about the fact that, I'm just feeling really tired. I don't really want to do anything, but I've been really tired for the last month. I've lost my appetite and I don't make any connection to anything mentally. My doctor is probably going to go down the pathway of looking at physical things that may be wrong with me and never make a connection to potentially thinking about depression, as opposed to communities, or let's just say families, being more specific. If I'm a family that may be more fluent in mental health issues, I may be more prone to mention something about the fact that I also don't feel as well. And just by mentioning the word feel, I don't feel quite the same about the interest that I used to have. I think that I may be feeling a little depressed. All of a sudden my doctor is going to be thinking something differently and may consider mental health symptoms that in the case of the former, of just mentioning physical symptoms doesn't come up. And so I think for a lot of reasons, this may also be why for people of color, mental health issues aren't diagnosed quite as early on. As it relates to treatment, for Hispanic children and Hispanic adolescents, medications just tend to not be used as frequently. Part of this, I do think, is around stigma within the culture. And so parents not wanting to put kids on medication. I also do think this has to do with just certain biases within the profession as well. So I think it kind of is on both sides of that. And then finally, just similar to Indigenous Americans and the importance of, just kind of mind, body, spirit connections, religion can be very positive within, I think, Hispanic communities as a protective factor. And by protective factor, what I mean is because religion can be very important to families, it can be a protective factor against mental health issues. And because people have positive religious connections, it can be a support when people are not feeling well. At the same time, religion can also be a reason why stigma exists. It's because people feel that their religion should be something that supports them. They feel guilty when they're feeling depressed because if I'm a good Catholic, then I shouldn't feel depressed because as a person of faith, that's not, if my faith is strong enough, then I shouldn't be subject to these mental health issues. And so, religion can be both a positive as well as not a negative, but a contributor to stigma. And so, again, the intention of those was just to give a little bit of flavor in terms of what mental health looks like in different communities. Because overall, no community is a monolith. No community is a monolith towards each other. No community is a monolith within itself. And so every experience is different. And yet I think there's still common things that kind of remind us that there are just systemic inequities that make communal experiences different. Next slide. And so as we think about just overall mental health considerations, so I talked about different pieces within those communities. There are different types of trauma that we talk about these days related to BIPOC communities. And the three most common are racial trauma, intergenerational trauma, and collective trauma. And so the first I want to talk about is racial trauma. And so racial trauma is really just at its core, trauma associated with just racial bias, discrimination, or racism. So it's just that racism being someone of a BIPOC group. And so, that comes to things like daily microaggressions. And what a microaggression is, it's sort of those subtle, sometimes unintentional comments or actions that take place that just remind you that you are a person of color. So a small one that may seem small, but I think that a lot of people have run into at some point in their life is you speak so well, or you're so articulate, or for someone, particularly of, let's say, Asian or Hispanic descent, where are you from? Making the assumption that someone is not American, but that they're from another country. And those are what we call microaggressions, because they're little things that, kind of death by a thousand cuts that may seem small, but in accumulation, they are traumatic experiences. The other type of racial trauma is the exposure to other people's experiences of trauma or racism, such as through media. And so what this can often be is thinking about the very recent incident of Jalen Walker in Akron, Ohio, just, I believe, last week, the young man who was shot 60 times by the police. And I'm sure many of us at this point have seen some of the video or heard some of the stories. That's racial trauma. Just seeing all of the media coverages of the different incidents of racism that occur, and having those things happen over and over and over again, and being reminded of just the racial prejudice and biases in society. And those are just traumatic incidents that have impact on someone's mental health. And I think oftentimes what is important to consider is we don't even think about the impact that these things have because they become so routine and so recurrent. And yet the reality is they do have, just like I said, death by a thousand cuts, is they have these very small but growing impacts in our psyche. The next thing I want to talk about are just intergenerational traumas. And so intergenerational traumas are not something limited to people of color. Everyone deals with them in different ways related to family intergenerational traumas, but as it relates to people of color, these are things like legacy of slavery. So when we think about legacies of slavery, thinking about separation of families for African Americans, One of the things that, I think about are things like ancestry.com. So, you see the ancestry.com commercials and you see people who are able to, easily trace their lineage back to Ireland and their family from like 500 years ago. And the fact that most African Americans can't do that because the legacy of slavery is that people lost those connections. They lost language connections, they lost tribal connections. And losing those sorts of histories creates a trauma to a culture and to a community. For Indigenous and Native Americans, the legacy of forced removal from Native lands, the boarding school experience for children. So those intergenerational traumas that from one generation to another have had certain impacts that continue to exist. Collective trauma. An example of a collective trauma that we've all had, the COVID pandemic, is we all have collectively been traumatized by COVID in some way or another. And so that's a collective trauma. Thinking about collective traumas recently, the communities in Uvalde, Texas, or Buffalo, New York, that recently had the mass shootings, those are collective traumas. And collective traumas really are those psychological reactions that impact an entire group. So thinking about sort of BIPOC collective traumas, intergenerational traumas and racial traumas are collective traumas. And what is critical about collective traumas and trying to heal collective traumas is you're trying to really heal something that's impacted an entire group of people. I would say maybe the silver lining of collective trauma is it also creates collective language, collective experience, and collective community. And so kind of out of trauma, on the other side, you can also have some very positive experiences that happen. One of the things, because there is sort of all of these traumas that happen, is I think people of color almost expect trauma to happen. It's such a given that communities almost, you teach kids to expect trauma. And so, I think trauma responses that have been developed are things like the talk. And so, I think for example, the talk has been something that's kind of come up more recently. And so it's something that people outside of the African American community, now know about, but kind of the talk that you give your kids, particularly your sons, when it comes to being stopped by the police or when you're out, out of the house, how do you present yourself? How do you take care of yourself so that you don't become another statistic? Code switching, which is something I think that almost most people of color do. And what code switching basically is how do I present when I'm in majority situations as opposed to when I'm in situations with other people of color? The work me may not be the me that my family sees. And so those sorts of trauma responses that kind of preemptively prepare me for things like racial trauma or collective trauma. Next slide. So what can I do? So, all of that is to say that there are a lot of things that happen that impact the mental health of people of color, through historical reasons, through current reasons, but there's still a lot that can be done. So it's not that these things are a given. It's not that these things can't be overcome. And I think there are things that individually we can do for one another and for ourselves. And so I want to spend the next few minutes talking about those things. Is on a positive side, how can we begin to really take care of our own mental health and our own well-being? And so this next slide is going to focus on how we can take care of ourselves. So the first thing I think we can do is to really connect with other people, is to recognize that no person is an island, and that, as much as we want to maybe feel like we can kind of take care of ourselves and subsist on our own, is that we can't. And so it's important to really create community and to create support systems. And support systems can look like any number of things, I think, in, in the 21st century. I think support systems include family, it includes friends. I think support systems can be face to face. I think they can be online. I think one of those silver linings of the collective trauma of COVID is things like this, is, you know, um, meetings like this that we would have always done face to face are now virtual, and virtual has become the thing to do. Therapy is now virtual, and I think that's something that's here to stay. And so online communities can be a support system. Cultivating relaxation techniques. I think relaxation is something that is really important to support one's mental health. So doing things like meditation or deep breathing or yoga or just going for a walk in the park, but trying to find something that relaxes you. So even if that's taking up a hobby like painting, but really trying to cultivate something that is just peace inducing, developing a sense of meaning and purpose in life. And this doesn't have to be, I think, some, big, meaningful question kind of purpose, but even finding purpose in every moment is, what is my purpose in being in this space right now? Maybe it's simply to connect with the person across the table from me. Maybe my meaning in this moment is to provide laughter to someone else or to help someone else achieve their goal. But really trying to figure out, how can I make the most of my life and my moment and my activity. Um, Developing healthy coping skills and healthy positive coping skills, because I think the reality is people may have coping skills, they just may not be healthy coping skills. So lots of times when we see people engaged in, let's say, alcohol or drugs, or just other poor behaviors, they're trying to cope. And so it's not that they're not trying to do the best that they can, they're just not healthy coping skills. So I think it's important to reflect on, what is it that I do when I'm stressed out, when life is challenging? Do I deal with those things in healthy ways? And if I don't, are there more healthy ways that I can deal with those stressors? And maybe some of those coping skills, may involve working with my support system. Maybe some of those coping skills are leaning into my my relaxing activities. Maybe some of those coping skills are trying to take off some of those stressors. Focusing on positivity, so changing perspective. I think very much in the world that we're in a news cycle kind of world, we can be very much inundated with negativity day in and day out. And so it's very helpful sometimes to turn the news off. If we're news junkies who kind of find ourselves kind of, constantly watching the news all the time, we're constantly scrolling Facebook and constantly, kind of binging on that sort of thing, maybe taking a news break, maybe taking a Facebook break and seeing what it does to your perspective. If that's your thing, maybe at least adding some more good news channels or good news feeds on, so that you're balancing your intake of sort of that negativity with some more positive things. There's a reason why they're kind of the people who look at the pictures of the puppies and the kittens and all that kind of stuff, because it makes you feel better, and so that's kind of the practicing gratitude is, do you spend time thinking about the things that you're thankful for? Because it really does begin to shift where your focus is. And all of these things really do contribute um, to kind of our mental health, taking care of your physical health. I mentioned earlier kind of the connection between mind, body, and spirit is when we take care of our physical health, it does impact our mental health. And in saying all of this does not take away from the fact that we are going to deal with mental health challenges that this does not address, and that we need professional assistance for, and that we may need medication for, and we may need higher level of care for. So this doesn't take away any of that. And these things still will help with those sorts of more serious mental health challenges as well. And so I think anything that we can do to support our mental health will help us, whether or not we have diagnosable mental health challenges or whether we're dealing with just kind of day-to-day stressors. In the next slide. And so if those are things that we can do for ourselves, it's also important that we think about our communities because we don't live, as I said, in isolation. So what can I do to support those around me? The first is to ask people how they would like to be supported. When I think about this, I think about, most of us grew up with the golden rule, do unto others as you would have them do unto you. Something I learned also was the platinum rule, which is do unto others as they would like done unto them. So asking other people, how would they like to be supported? So rather than assuming that you know what they'd like, ask them what they'd like. So maybe they would like you to go to appointments with them. Maybe if they're taking medications, they would like reminders. Maybe they would simply like just, help with the daily task or just a phone call. Maybe if someone's having a rough week, all they need is a text that says, hope you're having a good day. So just being there for one another, but checking it out what that person is actually wanting that to look like. Being aware of the warning signs that a loved one is becoming unwell. And so if I see that my loved one is maybe isolating a bit more, this is someone that I used to always walk in the morning with, and now for the last week, they've kind of put me off and they're not walking with me anymore, maybe checking in with them. If I'm living with a loved one who maybe is dealing with a more serious mental health challenge, maybe do they have something like a mental health safety plan where I know what their symptoms and triggers are when they are not doing so well, and maybe let's say their bipolar disorder is causing them issues, and maybe they're in a manic or depressive phase, and maybe I start seeing some of those signs and symptoms, and I know that I need to step in. I can care for others by caring for myself, so engaging in some self-care. It's sort of the oxygen mask. If I don't put my mask on first, I can't help you. So helping myself, getting educated. So I think one of the things that we can help not only ourselves, but our communities by is getting more educated in mental health topics. So there are a lot of great courses available. So there's something called Mental Health First Aid, which is a great 8-hour evidence-based course that teaches you how to be kind of a first aider for mental health related subjects. QPR, question, persuade, refer, which is kind of suicide prevention topic. NAMI does a number of great education classes. So getting more educated about mental health topics. Listening to our loved ones is people tell us oftentimes when they're in crisis or when they need something. We just have to listen. So when we listen to loved ones, within this, I also just want to kind of add, don't be afraid to ask questions. Don't be afraid to talk about suicide. Don't be afraid to talk about the hard topics, and listen to our loved ones when they want to talk about the hard topics. Notice changes. As I mentioned earlier, if we see people isolating, if we see people, changes in their functioning, people who used to be just on top of it, and all of a sudden it seems like things in their life are starting to go a little haywire. If we see someone struggling with addictions, that may be a time that we can step in and help figure out what's going on. And just nurturing relationships with our loved ones. I think it's important to just be aware of those things. And so this is how we may be able to care for those who are kind of the others near and dearest to us. And I think these are also very much things that we can do to take care of those who may be even a degree or two farther away from us. Is really, how do we care for our communities? We begin to care for each other. And the more we care for each other, the more that those efforts kind of begin to go out. And so, I think that's kind of it in a nutshell. Again, the goal of Minority Mental Health Month is raising awareness and trying to do more to help one another in our mental health. So at this point, I'd like to open it up to questions and comments.
Well, I'd like to say, Ms. Jones, thank you so much for that phenomenal presentation and the wealth of information that you shared. And as she said, at this time, we're going to open up for questions and answers. I think we did have one in the chat that she's already addressed. So feel free, participants, to put your questions in the question and answer section. If you want to raise your hand, we will be more than welcome or happy to unmute your mic for your questions. So at this time, anyone that has questions and answers, feel free to put them in the Q&A. I think we have one that's in the chat. Somebody wants to know, can we get a copy of the PowerPoint? I think, Janora, that's directed to you.
Oh, yes. And I believe the PowerPoint will be available afterwards.
Okay.
So yes.
Okay. So what we'll do, we'll get that name down and we'll make sure that you do get that presentation. Any other questions? Feel free to put them in the Q&A. And looks like we don't have any additional questions. We'd just like to say thank you, Ms. Jones, for such a great presentation. And I will turn it back over to Melissa.
Thank you.
You're welcome.
I think she had a couple other slides, some key sources. Yeah. I think we have one more question in the chat also for you, Janora.
Yeah. How often do you approach communities with this information? I guess in terms of personally doing, I guess, speaking and interaction with communities, I do a decent bit of, I guess, community education. And I get anecdotally haven't found the statistics to be too different than what I've seen practically. So I guess that's the only thing I can really say is I haven't found them anecdotally to be too different than what they've shown to be.
I think we have another question in the chat as well. Is there a way to download the transcript? Someone was having some auditory issues. Melissa, is there a way to download the transcript?
I don't think there's a way to download it, but these will all be uploaded under the member education tab on the partners website. So anybody watching this member cafe would be able to see Janora's presentation. You're very welcome. And we have a thank you in the Q&A, Janora. And I think that's all we have.
Okay, well, we'll turn it back over to you, Melissa.
And again, thank you, Janora. That presentation was absolutely wonderful and informative. I enjoyed it very much. All right. Let's see. Our official name is Partners Health Management, but we go by Partners. We are proud to share that we are a member care organization, or MCO, and a health plan, insurance plan for Medicaid and state-funded services. Think of Partners as part government agency and part insurance company. Partners does not provide treatment services directly to our members, but instead we make sure those who need treatment can get it through a network of providers who contract with us. All the money that Partners manages for the North Carolina is for meeting behavioral health care needs for you and others in your community. The better Partners manages that money, the more services and programs we can provide to our members. Our goal is to improve lives and strengthen communities by focusing on positive outcomes for our members. Partner serves 14 counties in North Carolina that are listed here on the screen, which includes Burke, Cabarrus, Catawba, Cleveland, Davie, Forsyth, Gaston, Iredell, Lincoln, Rutherford, Stanley, Surrey, Union, and Yadkin. The member engagement team here at Partners provides customer service as an extension of Partners Access Call Center. We support member empowerment initiatives that offer resources, advocacy, and education and navigation of North Carolina's public behavioral health and IDD healthcare system. Our staff is dedicated to building partnerships with our internal departments, providers, and other groups in the community. Member engagement staff work together with individuals and families and agencies in our communities that directly support them. You can reach out to our member engagement by phone or email, and that number is 704-884-2729. And the email is memberquestions@partnersbhm.org. We provide information about community resources, types of services, and your rights as a member. You will also find us on social media. The PICS Health mobile app can help you monitor physical and mental health. We encourage our members to register for the PICS Health phone app. You can download this app to your mobile device by going to www.highpix.com. The app enables you to interact with Pixar, which is a sweet chat box. Pixar can help you access resources and gives you helpful tips to live a healthier life. The PICS Health app focuses on daily mood and wellness check-ins, screenings for depression, anxiety, loneliness, and messages and assistance either through the app or by calling the Compassionate Support Call Center to chat with peers who have lived experience. The member engagement department receives referrals from the PICS Call Center, so we can follow up with members and or keep care managers in the loop. You will also find research-based games and activities inside the app which promote good health. Member Connect is a Partners member portal on Partners website. The Member Connect is in the upper right corner, and you can create a login, and it's just sort of like a healthcare portal. This enables messaging like an email to partner staff. Members, guardians will have easy access to documents in their health record, ISP or PCP, benefits, mental health screenings, provider search, member resources to include member handbook, rights and responsibilities, and how to file a grievance. The Member Connect is a really great way to kind of see what's going on. So check it out. Who do you call for support? If you're currently receiving services, call your provider with questions. Remember, they are your first responder in a crisis. For other service and crisis help, call our Partners Access call line, which is 1-888-235-HOPE or 1-888-235-4673. This call line is available 24/7. If you have a Partners Care Manager assigned to you, please give them a call with any questions you may have. If you have a brain injury or traumatic brain injury, call the Partners Access Department 24/7. And again, that number is 1-888-235-HOPE or 4673. Staff will discuss potential resources. Currently, a TBI waiver is being piloted in the Raleigh area. Once you call in, you will be added to our system so that when Partners has a TBI waiver available, we can contact you. Next slide, please. CFAC is a volunteer group made up of members and family members representing those who receive mental health, substance use, traumatic brain injury, and intellectual and developmental disability services. CFAC advocates on behalf of those individuals to improve the public behavioral health system. Partners Consumer and Family Advisory Committee, or CFAC, is looking for members. For more information, email us at cfac@partnersbhm.org. And to find out more about Partners CFAC, you can visit www.partners.org, Consumer Family Advisory Committee. And Kimberly's going to be popping those in the chat for you, so you can just copy and paste them if you need them. It's important to stay in touch with us. Please do keep your contact information updated, as if we need to contact you about your health plan, we'll be able to reach back out to you. If you receive Medicaid, it is super important that you keep your contact information up to date with your local Department of Social Services, or DSS, for the same reason. They may need to contact you about your Medicaid. If you receive state funds, please keep Partners or your local MCO up to date. Here at Partners, call our Partners Access line. And again, that number is 1-888-235-HOPE or 4673. Phase 1 of the North Carolina Medicaid transformation began July 1st of 2021 with the standard plans, and those were AmeriHealth, Caritas, Carolina Complete Health, Healthy Blue, United Healthcare, and WellCare. Medicaid recipients either chose or were auto-assigned to one of these plans. Phase 2, which is tailored plan, begins on December 1st in 2022. Tailored plans will provide the same services as standard plans. Additionally, tailored plans will provide enhanced behavioral health services for beneficiaries that may have a significant mental health need, intellectual developmental disabilities, traumatic brain injury, or substance use disorder. Most people who receive behavioral health, IDD, and TBI services through their local management entities, managed care organizations, which is your LME or MCOs, will transition to a tailored plan on December 1st, 2022. North Carolina Medicaid will complete a review of the Medicaid beneficiaries to determine who qualifies for tailored plan. Beneficiaries who no longer qualify for tailored plan will receive a notice from the North Carolina Medicaid enrollment broker about their choices. Those who do qualify for tailored plan will be auto-enrolled based on managed care status and their administrative county on 8/1/2022. During the choice period, which begins August 15th of this year, 2022, beneficiaries will choose a primary care provider, or PCP, and tailored care management provider with their tailored plan. The enrollment broker can assist with selecting a PCP and tailored care management provider. Some beneficiaries may choose a different health plan. The choice period, again, is between 8/15/2022 and 10/14 of 2022. What happens if you do not choose a primary care physician PCP and a tailored care management provider? Well, you will be assigned to one by your tailored plan, which is Partners if you're with us. Beginning 10/15/2022, tailored plans will begin mailing out welcome packets and Medicaid ID cards. Beneficiaries can contact their tailored plan for assistance or the enrollment broker for assistance. Beneficiaries will begin receiving healthcare services from the tailored plan again on 12/1/2022. Thank you for being with us today, and please join us every month on the second Tuesday from 1 to 2 p.m. for our monthly member cafe. As soon as the presentation ends, a short survey will appear. We ask that you complete that before you close the Zoom window. This really helps us to know a little more about your needs and interests. And do we have any questions, Lindsay, at this time?
We do. We had one more that came in. Will there be a certificate for the people that attended the webinar on today?
No, there's no certificates for Member Cafe. Thank you for the question, though. I believe that's it. Well, thank you so much again, guys, for joining us today. I hope that you guys have a wonderful rest of your day, and we appreciate your time.
Have a good afternoon.
Yeah.